Hello friends, thanks for checking out the video. Be sure to like and subscribe as it greatly helps out the channel and I'd really appreciate it. Enjoy! Alright, so yes, we've obviously talked a lot about Christian relationships and COVID, and now it's time to share the love with the other side of the political spectrum.
Yeah.
So what are pandemic risks that are associated with more liberal
Yeah.
side of politics?
So I want to be clear. So, my research has been focused on conservative politics and conservative religion, because I focused there first because I saw the most immediate connection to the pandemic risk, right?
Mhm.
Because those were the vocal kind of opposition to public health initiatives and so forth. So I have framed conservatism as an existential threat during a pandemic. But I think it could be extended. Same groups of people also are like environmentalists, deny climate change and so forth. I think it's time that we really start to think seriously, about threat of conservatism. But I will say this, that doesn't mean that the liberal side of the spectrum and Democrats can be absolved, from some of contributing to the culture war, and I think also
Mhm.
denying science. Okay, you could think about. It may have started out that Democrats were like all on board with whatever the CDC was saying at the time, and
Mhm.
that Republicans were not. But the problem is that as the CDC has changed their guidelines to pull back mandates and so forth, the Democrats have stuck with it, have maintained that, and in a sense are now conflicting with the public health CDC guidance. So it would be hypocritical for us to judge conservatives for denying the public health recommendations, but to not also similarly judge or question or wonder why Democrats are, especially like in states like California, are still
Mhm.
maintaining mandates and pushing vaccines and they want you to mask your children. They want you to get repeated vaccinations, even if you're not at risk.
Yeah.
They want to vaccinate children, younger children, without clinical evidence to support the efficacy of vaccinations for young children. Um, they want to avoid. There's a lot of Democrats and people I know like that. They still don't want to eat inside restaurants. They don't want to go to
Yeah.
public events and so forth because they believe there's still a large segment, I believe, of Democrats who believe they're gonna evade or avoid getting COVID the rest of their lives, and
Yeah.
that's not true.
Yeah, it's pretty much
Yeah,
right. You have to shelter in
yeah,
place for life now
yeah,
to even have a
yeah.
chance of that. Yeah,
It's not possible. It's not
it
possible.
it's
It's
not.
endemic now. It's
Mhm.
endemic. It'll be with us for the rest of our lives. We're going to get COVID. It's going to be a seasonal thing. People are talking about that. But we have to also recognize that actively trying to avoid your breakthrough infection after you become vaccinated, that does not help with herd immunity. That does not help because you have to understand the epidemiological data has made it really clear that the healthiest group are people who have a vaccination and a breakthrough infection. That's called
Yeah.
hybrid immunity. Okay, it's having both the immunity from the vaccine and immunity from an infection. Those people have the lowest rates of morbidity and mortality from the epidemiological data, and that's
Mhm.
that's better than a vaccine alone or better than infection alone. And so that's like really important to realize. Um, but I think we have to really be skeptical about, what does masking children, giving vaccines to children, giving people boosters for the rest of their life. When there are immunologists, I've heard immunologists wonder about how continuous boosters of these vaccines might alter our immune system going forward.
Right.
And you had said this earlier. We don't know much about um, effects of long COVID. We don't know much about, in my opinion, and what I've known. I'm not an immunologist. I'm not a medical doctor. Not a real doctor. Um, but we don't know much about the long term effects of these vaccinations because they weren't
Right.
properly tested,
Right.
and they're certainly not. They certainly have not been properly tested for young children, even though they're being allowed to be trying to push them on young children. And you'd have to wonder how much of this is something that we call in medical sociology disease mongering, where where the pharmaceutical companies and the politicians that they bought off are just kind of expand their markets
Mhm.
for the vaccines,
Yes.
and we have to wonder about that. have to wonder about that because we know our politicians are paid by pharmaceutical companies. We have to wonder about their motivations, for pushing these vaccines on us. And I'm very critical of pharmaceutical industry, and so we have to be very concerned about that. I think we also have to, when you're thinking about um, mandating vaccines and so forth, you have to really start to question whether or not where you personally fit on the issue of bodily autonomy.
Right.
If you support the issue of bodily autonomy in the case of abortion, do you support the issue of bodily autonomy in the instance of requiring people, mandating people to get vaccines, or they'll lose their jobs, or they'll lose their
Yeah.
livelihoods and so forth? Is that really what we want? And ultimately, this is the question that I want to leave people with: is when you think about how Democrats and liberals have approached the pandemic, and thinking about their current behavior and how they are kind of acting at variance with the CDC recommendations. Was this really about the science?
Right. That's oof.
Yeah,
Yeah, that's a thinker
yeah, it
because
is.
definitely got some opinions, got
Yeah.
some people going in chat, that's for sure.
Yeah, well.